Blue Cross Blue Shield of Michigan recently encouraged providers to code all of their members based on which of the following? A. Each PILB. AAPC medication list de-risk. What is a significant impact of undervaluing billing professionals? A. Increased turnover in coding departments. B. Overbilling patients for medical services. C. Reduced patient satisfaction scores. D. Prolonged accounts receivable cycles and revenue loss when an assistant surgeon is a physician's assistant, nurse practitioner, or clinical nurse specialist, which modifier should be appended to the CPTE surgery code? A. ATB, 81C, AESD. Concept does not apply. What is the purpose of using modifier 59? A. To indicate a procedure was performed bilaterally. B. To identify a procedure was staged or related. C. To show a distinct procedural service. D. To report a repeat procedure, a patient presents to the emergency department with gastrointestinal bleeding after accidentally taking 2 doses of a direct oral anticoagulant within 12 hours. Which ICD-10 codes should be assigned to document this scenario? A. Z79.ONE, I48.NINETY1B, Z79.ONE, T40FIVE.FIVE15AC, T40FIVE.FIVE15A, K90TW or .TW or D, T40FIVE.FIVE15D, K90TW or .TW, or which of the following conditions might a patient also have when in alcohol withdrawal? Gastrointestinal bleeding. B. Pancreatitis. C. Cardiomyopathy. D. All of the above. For a highly complex procedure requiring skills of more than 2 surgeons, each surgeon will submit a claim with which modifier? A. 62B, 66C. AD concept does not apply. Implementing AI in denials management has demonstrated which of the following? A. Significant or OIB. Increased denial rates. C. Physician practices going bankrupt. D. Humans are no longer necessary. What are the job skills that trauma registrars need? A. Good communication skills with patients, families, supervisors, and co-workers. B. Excellent analytical, problem solving, and organizational skills. C. Knowledge of AIS coding and ICD-10 coding. D. All of the above. Why is the CPBE credential important for billing professionals working in value-based care models? A. It helps professionals understand how quality metrics impact reimbursement. B. It focuses on medical coding accuracy. C. It teaches advanced clinical documentation improvement methods. D. It ensures compliance with patient care standards. What is the primary purpose of modifier 24? A. To identify a separate EM service. B. To report a subsequent procedure. C. To indicate a service unrelated to surgery. D. To notate a waived service. Which of the following ICD-10 codes is used to indicate long-term use of a direct oral anticoagulant for anticoagulation therapy? A T40FIVE.FIVE15AB, Z79.ONEC, I48.NINETY, Y1DK90TW or .TWO, which group furnishes guidelines that an ODS must follow for appropriate classification in cancer registries? Surveillance of epidemiology and end results. SEERB, OSHC, abbreviated injury scale. AISD. All of the above. Which of the following is not a KPI mentioned in Heather Green's article on CDI? A review rate. B. Query rate. C. Error rate. D. Agreement rate. What measurement is used to calculate a person's body mass index? A height weight. B. DXA scan. C. Skin folds. D. Any of the above. A patient with alcohol dependent states he is having trouble sleeping at night. How is this coded? A. F10.ONE 182B, F10.TW 182C, F10.NINE 182D, F10.TWE, and TY G47.NINE. Which of the following is a free way to earn CUs through AAPC? A. Taking the monthly magazine quizzes. B. Signing up for an exam. C. Commenting on the forum. D. Reading an AAPC white paper at an annual visit. The physician notes that the 15-year-old patient has obesity with a BMI of 35. How is this coded? A. Z68.FIF-TY3B, Z68.FIF-TY4C, Z68.FIF-TY5D, Z68.FIF-TY6. Effective Jan 1, 2026. Medicare will require prior authorization decisions for standard requests of medical items and services within how many days? A. 7 business days. B. 7 calendar days. C. 14 business days. D. 30 calendar days. What is the ICD-10 code for memory loss due to alcohol use? Or 41.THREB, F6.EIGHTC, F10.NINETY6D, F10.NINETY7. Thank you for watching my video. Please like and subscribe.